So, International Women's Day is a celebration of all the advocates and allies that are working for a more just and equal future. It celebrates the amazing legacy of activists who have come before us and done incredible work for youth activists to stand, and to celebrate all the work that continues to be done today by and for women. Hi everyone, so my name is Tori Ford and I'm the founder of Medical Herstory. We are an international award-winning nonprofit led entirely by youth on a mission to eliminate sexism, shame, and stigma from health experiences. We do this through our three main portfolios of medical education, patient advocacy, and undoing stigma. And we have an amazing team of over 70 volunteers across 24 universities and 7 countries. Medical Herstory works both on a local and international scale, and this is because a lot of the issues that we're tackling are big issues and they're international. So problems of sexism, shame, and stigma are really pervasive within our health experiences. They shape how women and gender diverse people understand their experiences, they affect the care that we'll receive, and ultimately they really impact patient outcomes. We know from studies that women's pain is less likely to be believed, they're more likely to be diagnosed even when having a heart attack, and that they are often dismissed as sort of that their symptoms are in their head or not that serious. So this can have really damaging consequences, from lost access to lost hope and lost lives. And this is where Medical Herstory comes in. So trying to promote gender health equity through medical education, patient advocacy, and undoing stigma, and really tackling these issues head on by creating an organization that not only supports these communities directly, but is also informed and led by people with lived experience of these issues. In my video, you're going to see what a day in the life looks like. Because it is COVID-19 and because we're an international organization, my entire day takes place online. So you'll be seeing what that looks like, how we communicate across 7 different countries and many different time zones to create a united team working to advance gender health equity. Hi, I'm Tori Ford. I'm the founder of Medical Herstory, and today I'm going to be showing you what a day in the life looks like. Because we're an international not-for-profit, and because it's COVID-19, my entire day will be taking place right here. Medical Herstory is an award-winning international not-for-profit on a mission to eliminate sexism, shame, and stigma from health experiences. We are entirely youth-led and have over 70 volunteers across 24 universities and 7 countries. We all work together based on project, not location, across our 3 main portfolios: medical education, patient advocacy, and undoing stigma. We run events, host workshops, produce social media campaigns, and help everyone tell their stories through our publication. Through our amazing work, we are able to empower patients, educate medical professionals, and engage the public on gender health equity. I like to start my day just by checking that the website is up and running, and if it needs any back-end work, that I can take care of that before anyone else wakes up and sees it. Also, this website is really where Medical Herstory began. It started with my own story, which you can always find at the bottom of the homepage right here, which was about living with chronic yeast infections and just feeling utterly alone, ashamed, and embarrassed. There wasn't a platform that existed to share these stories, and so I created one. And it's really humbling to see where this organization started and how much it's grown today. We have now featured over 23 different health conditions and are always looking for more stories and topics to cover. And if you would like to join our movement, we are accepting volunteers for our next recruitment cycle. As the founder of Medical Herstory, I do a lot of work in terms of governance, leadership, and strategy, but I also really enjoy getting back to my roots of sort of doing the grassroots work on the day-to-day. When I founded Medical Herstory, it was by myself, and it was a lot of learning to do in terms of website design, grant writing, and event planning. Now I'm lucky enough to have a brilliant team who manages most of this work, but I still love being able to dip my hands in different pots and help out throughout the day. Because our volunteers are all across the world, everywhere from Japan to South Africa, when I wake up in the morning in Montreal, I'm already behind. I like to start my day by checking my emails and my Slack with our teams to make sure that everyone is okay and that they know what they're doing for the day. The next stop is the Medical Herstory Notion. This is the behind the scenes of where all the magic happens. Notion is my favorite online platform for keeping track of our volunteers and being able to work collaboratively across all of the different time zones. As you can see here, I'm a big fan of celebrating our team's wins, and I love to have everything organized by our 3 main portfolios. So I'll show you medical education quickly, and here I can check in on all of the volunteers and get a glimpse of the workshops, events, media, and publications that the team is planning for the upcoming week. A large chunk of my day is usually spent on Zoom, and it's become a really great platform to connect with people around the world. I'll be talking with partners who are interested in collaborating on an event with us, groups looking to book our workshops, interviewing people to potentially join our team, and also participating in a range of podcasts, interviews, or radio shows. And doing press is one of my favorite things for Medical Herstory because it's a way to reach a different audience and get our message out there. Another favorite part of my day is being able to do our social media post. We try to do at least 3 posts a week. So here I am just editing one post that's going to be going up. We love seeing the engagement and commenting and helping raise awareness on these really important issues. Medical Herstory is obviously my baby, and any time I get to spend on it, I love. But I also have many different responsibilities throughout my day. Like many of my volunteers, I myself am a student and starting my PhD in primary care health sciences at the University of Oxford this fall. That means that a lot of my time goes to academic study, but luckily I get to study chronic yeast infections, yes, the condition that I live with, so it all sort of overlaps. I'm also really fortunate enough to be involved with some other local and international groups that help me reflect on Medical Herstory and continue to grow it. So although my day is divided into many parts, it all centers around this larger mission that I've dedicated my life to of eliminating sexism, shame, and stigma from our health experiences. At the end of each day, I like to take the time to reflect on what could have gone better and what went great. I think with this work, it can be really difficult to see the bigger picture sometimes because you can get so bogged down in the day-to-day activism and content production. But I'm really lucky with Medical Herstory that I often get to see the direct impact of our work on the populations that we're trying to reach. Whether that's hearing from a medical student after attending our gender bias workshop about how much they've learned and how they are so determined to do better, or someone who just shared their story through Medical Herstory about how it was their first time speaking out publicly and how empowered they feel, or someone who came to an event and learned something that day, and even just a simple DM saying, "I love your content, keep it up," really makes all the difference. I'm so grateful that this is the work I get to do on a daily basis and to everyone who supports me and our team, and I can't wait to keep doing it. Thanks so much for checking out A Day in the Life. If you're interested and this looks like something you'd like to be doing in your daily life, reach out to us at Medical Herstory on any of our social medias, and we'd love to hear from you. Have a great rest of your day. Bye! So I've been really fortunate that Medical Herstory is a really healing space, and a lot of the work that I get to do in caring for my community also sort of feeds back into caring for myself. So the whole organization started when I shared my experience of living with chronic yeast infections, a very taboo topic and not something that most people speak openly about. But I'd been living with it for years and feeling very frustrated of doctors telling me it was just my body's normal. Some people get colds, some people get chronic yeast infections. And I decided to speak out about it, and I wrote for our school newspaper. I found the healing process to be amazing in sort of being able to put what had been going on for years into words. And once I shared my story, it actually made the front page, and I started hearing from so many other women and gender diverse people that they had really similar experiences. And then we didn't have a platform to talk about it, so I created one. And through doing that work day in and day out of receiving stories from people, sharing them and seeing how they get to transform and build and grow through these stories, and giving the feedback that it's the first time they're talking about their STI diagnosis or having an abortion or their long journey to get birth control. And we get to share those stories is really empowering. So I'm very fortunate that the work itself, I get to see the direct impact, whether it is publishing people's stories, giving workshops about my own health, and the patients that have written our own workshop curriculum to medical students, hosting events with amazing influencers and doctors and people talking about their own experiences, or making social media posts for everyone to sort of share and learn and build community around. It's really empowering work, but I'm human. At the end of the day, I like to watch a good Netflix show. I love getting a good meal. I love spending time with my family and friends and just really prioritizing that. And I'm fortunate fortunate enough that it melds really well into the work that I'm doing. And I think it's really important because when these issues do hit close to home, I think medical Herstory is really good about taking a trauma-informed approach and giving people space and time, because there's definitely days where my chronic illness is flaring up, I'm not doing well, I need a day off. So I think as much as self-care and sort of the small things we do is important, it's really important also to have structures in place, support systems in place, and organizations that are really accommodating for everyone on your team, whether that's a volunteer or even the founder. The COVID-19 pandemic has really revealed how now more than ever, we need access to reproductive health and sexual health, and really uplifting voices and organizations that are supporting vulnerable populations. I think today more than ever, we're really seeing young people step up and speak out about issues that not only directly affect them, but that they feel really strongly about and demanding change. So I'm really proud to be a part of a much larger movement towards destigmatizing our bodies and advancing sexual and reproductive health and rights. Medical Herstory has really become a centralized place for sharing stories that we were once too embarrassed to talk about because maybe they're too real or messy or often really taboo. So in sharing these stories, we've been working to remove stigma and shame and working to advance gender health equity. And I think that what we've seen is by partnering with other like-minded organizations, we're working to really create a robust network of feminist health activism across Canada and globally that's led by youth and centers our own lived experiences. I believe a feminist recovery would look like reprioritizing and following the lead of those actually directly affected by the issues that we're trying to remedy. In the case of gender health equity, it looks like investing in resources to better understand and solve gender disparities in healthcare. It looks like ensuring equal access to and education on women's health. And it means creating a robust network of patient advocacy and undoing the stigma that keeps patients suffering in shame and silence. And with all that, I think what a feminist recovery would look like is investing in resources, organizations, and individuals to ensure a compassionate and comprehensive healthcare for all.